My name is Suri Moon. I'm co-director of the Global Health Center here at the Graduate Institute of Geneva. I'll be your moderator today. And we will be focusing on the role of law, global health law in particular, in trying to get the COVID-19 pandemic under control. I'm delighted to have with us today two of the world's leading experts on this issue. First, Mr. Steve Solomon, who is the Principal Legal Officer for Governing Bodies at the World Health Organization. He was centrally involved in the negotiation of the Pandemic Influenza Preparedness Framework and has previously served at the US mission to the UN in Geneva, working on human rights and humanitarian issues, as well as at the US State Department prior to that. Second, we have my colleague at the Graduate Institute, Gianluca Berci, who is Professor of International Law, was formerly legal counsel of WHO until 2016, is the co-editor of an excellent volume on global health law that was recently published, and also directs the joint LLM program between the Graduate Institute and Georgetown Law. He also advises us at the Global Health Center on academic matters. So Steve and Gianluca, thank you so much for making the time in your very busy schedules to join us today. Let me begin with a few words just to provide some background context for today's discussion. There are multiple areas of national and international law that are relevant to the coronavirus crisis. Human rights, which of course we covered last week in the webinar, and for those of you who missed it, the recordings are available on our website. You can go and watch it. But a number of other issue areas: trade, transport, intellectual property, competition law, privacy law, criminal law, the list could go on and on. We may touch on some of these today, but of course we won't have time to go into all of them, so these may also be the subject of some future events. I think the legal ramifications of this pandemic are widespread, and they're really just starting to become apparent. We're also starting to really understand just a little bit better the possibilities and the limits of the law as a governance tool to respond to this crisis, both at national and at international level. Today, we'll be focusing on the core international legal instrument that was negotiated to help the world prepare and respond to infectious disease outbreaks, the International Health Regulations, or the IHR, as it's often called. The roots of the IHR go back at least 150 years, and their original purpose was to prevent infectious diseases from interfering unnecessarily with travel and trade. They give WHO certain powers, but of course these powers are not unlimited, and we'll hear a lot more about that from our two speakers. As many of you are already aware, generally speaking, international law is much more difficult to enforce than national law. Compliance is always a big question when we talk about international law. During the coronavirus outbreak alone, epidemic alone, we've seen 149 countries or territories impose travel restrictions. 28 countries have implemented export restrictions of some kind. We also have had at least 8 countries that have in fact eased import or export restrictions. And this data is likely an undercount. This is official data that's been reported to the World Trade Organization. Some countries have followed WHO recommendations, for example, to get ready for the arrival of the virus in their countries, to identify and isolate cases, to test as widely as possible. And some countries have not. So to paraphrase the great Tina Turner, who needs the law when the law can be broken? So a number of questions have arisen around the law. How well have the IHR functioned in this crisis? What powers do they give WHO and what do they not give WHO? Do the IHR need to be revised? We're going to be tackling each of these questions during the next hour. Let me just remind you all, first we'll hear from our two speakers for about the next 25-30 minutes or so, and then I'll be turning to your questions and comments. You can type these right into the Q&A box that you see at the bottom of your screen, and you can also respond to each other there as well. So Steve, let me first turn to you to introduce us to the IHR and to give us a sense of what is the purpose, how do the IHR work in practice, and how have the IHR been implemented in the context of COVID-19? Thanks very much for joining us. Over to you.
Suri, thank you. First, let me say generally thank you. Thanks for involving us in this. We really appreciate it. These kinds of engagements are really important to promote understanding of what of how the law works. Second, let me say that whoever chose the title, great title. What's the law got to do with it? So kudos for making this sound very interesting. For those of us on the inside, it is that interesting, and we hope we can share with those who are listening in and watching why that is so. And then let me offer this disclaimer, which is I'm going to be presenting information and ideas that aren't necessarily those of the World Health Organization. And I'll try to make clear when I'm doing that, when I'm talking about what other voices are saying, what we're hearing, and things like that. But I'm going to be, in order to be able to do that, I want to make clear that some of these things are not necessarily going to reflect the views of the World Health Organization, and I'll make that clear when that comes up. So very briefly, what are the IHRs? These are, I think the most important thing to understand is they are a legally binding instrument adopted by the World Health Assembly. And I'm going to show you the really interesting provision that is in the WHO Constitution, which allowed the IHR to enter into force in a way that most treaties do not enter into force. As you know, most treaties enter in force one by one. Member states sign it, and then they provide instruments of ratification. And over time, an instrument builds up in its number of states parties. That is to say, most treaties are opt-in arrangements. Each country has to individually opt in. One of the things which makes the IHR so unique and so forceful as a framework for, under international law, for managing the response is it is not an opt-in arrangement, it is an opt-out arrangement. Everyone is bound at the same time, all in this case 194 and then 196. And I'm just going to share that screen with you so you can see where it says this. So you'll see, if you can see now the Article 21 and 22, is that visible to you?
Yes.
Yes.
Yeah, so you'll see in Article 22, this is the WHO Constitution you're looking at. Article 22 says that regulations, which are addressed in 21, shall come into force for all members, so all at the same time. And now I am going to go back to if I can get this, well, this is, maybe your technical people can help me get that off the screen and go back to the main picture because I'm not seeing that button. Yes, thank you very much. Okay, adopted by the Health Assembly in 2005, came into force for all 194 member states of the organization in June 2007. 2 other member states came on board. So it actually has more, 2 other countries came on board. It actually has more parties than the WHO has countries. So WHO has 194 members. The IHRs have 196 because 2 states that are not members of WHO came on board. They're Liechtenstein and the Holy See. I say this because it underscores the global reach of this instrument. The purposes of the IHR, and maybe your technical people can help me this, is set out in the, right in front. The purpose is to prevent, protect against, control, and provide a public health response to the international spread of disease while, and this is the important proportionality aspect of the instrument, while avoiding unnecessary interference with international traffic and trade. And much of the IHR really focuses on this sense of proportionality in a number of ways, and I'll get that. So I'm going to provide a bit of a list in 3 areas, and each of these lists is going to include 5 components. I'll pause after this first list of 5, but I wanted to go over the 5 key mechanisms of the IHR. What makes the IHR work? The first key mechanism is notification. All states have an obligation to notify us of events that could constitute a public health emergency of international concern. Let me drop a footnote when I say public health emergency of international concern, because it has what is probably the most unfortunate acronym in the public health area. It is called, or has been called, a FAKE, which is, as is obviously the case, a very unfortunate acronym. It's been called also a FIC or a FEAK, but it's a public health emergency of international concern. I'll be using the term a FIC. So all states are required to notify us of events that could constitute a FIC. And based on that information, WHO reports on the event through a system that alerts all the states parties to it. That's the first mechanism. The key mechanism is, and this is of central importance because it has to do with non-fixed situations. It has to do with peacetime, if you will. All states are required, as the second mechanism, to build and establish national core capacities for their health systems. They have to have systems that allow for the proper surveillance and the proper response if there is response needed. The third mechanism is recommended measures that are evidence-based. So these are known as temporary recommendations. When a FIC is declared, the Director General, on the advice of the Emergency Committee, issues temporary recommendations with guidance on everything from travel to control measures to clinical measures. These are called temporary recommendations, and they are addressed by the Emergency Committee, which brings me to the fourth mechanism. The fourth mechanism is the systems for external, independent, evidence-based advice for implementing IHR. And there are two such mechanisms. The Emergency Committee, which advises on the establishment or declaration of a FIC and any appropriate temporary recommendations. They don't take decisions, they recommend it to the DG. And a so-called Review Committee, which takes a larger look through independent experts and provides that independent aspect. And these are a centrally important mechanism, particularly as there are questions about the impartiality of WHO processes. Finally, the fifth mechanism is an accountability mechanism. What member states do in response to a FIC can vary, and they will take decisions in their own sovereign capacity. There is the overall intention that they align with the recommendations of the organization, these so-called temporary recommendations, but each state, each party is able to make its own assessment. When they do so, there's an accountability mechanism to WHO staff that allows us to look at those additional steps that states are taking and look to whether they are proportional. So those are the five mechanisms, and I hope answers the question of sort of how the IHR work mechanically. And then we'll be talking more about the sort of five principles that underlie it, but thanks, and I know Gianluca was going to address this,
Thanks very much.
these other aspects.
Thanks very much, Steve. Super clear introduction to what the IHR, what the IHR are. I want to turn to Gianluca for a minute to give us an analysis of what are, in your opinion, some of the major weaknesses and the strengths, and how have those strengths and weaknesses been seen in the current crisis? How well have the IHR been performing?
Yeah, thank you, Suri. Can you hear me?
Yes.
Okay, thank you. And well, Steve has already alluded to a number of important things. I would say, so starting from the strengths, the IHR is a modern instrument. It really revolutionized the previous assumptions on how to control and prevent epidemics. And why? First, because it covers all sources of international spread of disease, not just the COVID style, but also even acts of bioterrorism or industrial accidents. So really it's an all-hazard approach, which I find very, very modern and very holistic. The second is that it's sensitive to context. Since it's so open-ended, it cannot have like rigid fixed rules. And so if you want, the emergency alert part of the IHR relies a lot on surveillance, on assessment, on a dialogue between WHO and the states concerned. So it's really an operational instrument that tries to adapt response to context. The third, it's very much the whole, if you cut across the instrument, you see it's very based on risk assessment. WHO and states should do things that are necessary and proportional to the risk. And that was very much on purpose also to facilitate consistency between the IHR on the one hand and other bodies of law like human rights and trade to avoid conflicts that would have weakened inevitably the IHR. So that to me is also, it's an evident strength. The other point, it's very embedded in WHO. It's not like one of, say, the environmental conventions that develop their own governance and so on. The WHO is really the manager, the custodian of the IHR. And so also non-emergency programs, I think, contribute to the purpose. Think, for example, on the program on specific diseases, on health systems, on universal health coverage. Those are, to me, synergistic to the overall purpose of the IHR. The fifth point is that there is an element of political realism. We can dream of WHO turning into the policeman of global health. It will never happen. So we try to reach a realistic balance, an implementable balance between the authority of an international organization, which is remarkable, as Steve said, in giving the Director General the possibility to declare emergency, even against the will of the state concerned, but also the sovereignty and the authority of the states. I'm not sure that the balance is the optimal, but there was an exercise in political realism. 6, it integrates human rights, which didn't happen in the previous regulation. That's very important, and we are witnessing now the impact of a health emergency on human rights worldwide. And 7th, it has, if you want, an unsung, less spectacular part, a routine part, on measures that happen at the border, on things that have to be done, on certificates. And that's, I want to highlight it because it's an essential part. It's a part that strengthens surveillance and prevention. And you don't hear much about it. So I hope no news, good news. So coming to the weaknesses, to me, the first weakness, and that's not something I see in the literature, is there is a fundamental assumption underlying the IHR that I wonder whether it's really standing up to the test. And the assumption comes out of the SARS lesson. When the world woke up to the powers of WHO without a legal framework to support it, but also to constrain it, and given the rush to finalize the IHR, states basically codified what WHO was already doing, but it was doing it in a more flexible situation, not within the constraints of illegal instruments. And so some of the assumptions, for example, the compliance pool of WHO recommendations, I'm not sure they really stood out to the test. And that's something that we will have to look into, because evidently that's a weak part of the framework. The second is this system of alert. Right now is either we have an emergency or we have nothing. And I think there is a growing consensus that has to be supplemented or replaced with something much more incremental. And I personally would favor scrapping the term emergency. It's so loaded, it's so fraught that I'm not sure it's been very beneficial. The third is the core capacities that Steve was talking about. It's clearly an unmet challenge in developing and developed state. And that core capacity had to do with public health systems. So there really talks about the choices made by individual countries, the underinvestment, the privatization, the sometimes distortion in how public health and healthcare is organized. And we can see the international consequences of those choices. It's a huge challenge. The fifth is, and that's maybe something more technical and people don't think about it, there is no system of dispute settlement. The one we have is very weak. We look at what's happening now, border closures, trade limitation, these are the seeds of major disputes. If we had a system more agile, less formal, to try to settle these disputes now, to try to have a consultative mechanism, that to me would strengthen the implementation of the IHR and would decrease the risk of a huge avalanche of litigation and tension down the line. The sixth is the WHO recommendations, as I said. I don't think it's fair to say there have been a failure. If you look at the sixth emergency declared by WHO, many recommendations have been followed and implemented. But the ones on international measures are clearly the weakest, and we have to wonder why. And finally, the system of accountability is weak. States can do whatever they want without much accountability. There's a sense of impunity. There is a resistance to naming and shaming. There is no system of, if you want, assessment of compliance. And so that to me is another weak part. Decreases the incentives to comply. So I will stop at that. These are to me the main strengths and weaknesses. Over.
Thank you so much for that really thorough overview of both strengths and weaknesses. And one of the strengths that you mentioned was that, in fact, this body of rules is embedded within WHO. And certainly over the last few months, we've seen this question coming up over and over again, not least in the last week or two, regarding what is the role of WHO, what is it able to do? And we've seen, I think, in the media quite a huge range of impressions regarding whether it is, does it have superpowers? Is it kind of like God? Or is it a very weak, small thing? And so I think that on this question, it would be terrific to hear, Steve, from you, your views on what is the role of WHO in the response to COVID-19, both within IHR and also looking beyond the scope of IHR.
Thanks very much. And Gianluca, thanks for that list of both strengths and weaknesses. Having that kind of input, understanding that is going to be an enormous part of what comes next in the global response to build the future architecture of the global health system. And I think you know, what we can do to improve the IHR is going to be central. Gianluca, in response to some of those, I will have a short list I'd like to offer later. It's a list of 5 things to make the IHRs great again. I call it my MEGA list. So I will, and it captures, I think, many of them. But so here's what WHO, in terms of WHO's role, particularly in the context of the COVID response, but whenever a FIC is declared, we look, WHO's very fundamental responsibility is to advance certain key principles that you find in the IHR, that countries, when they negotiated it, made very clear were part of the IHR. And here I would like to switch to a screen because I think your viewers might like to see what this instrument, which looks rather dense, and it is, what it actually says, because these are not stated in complex language or in any verbose way. So I'd like to just walk through a quick of these 5 principles that WHO supports. The first one is as I've mentioned, the principle of proportionality. And that is found in this Article 2, where it says, as I've said, that controlling and preventing the international spread of disease, again, an all-hazard approach, but in ways which avoid unnecessary interference with international traffic and trade. So that principle of proportionality is something that WHO focuses a great deal on. It is why we are so careful in having an evidence basis for our guidance and our advice and our information products. The next thing is the principle of respect. And this is found in paragraph 1. You can see this, the implementation, and it goes again to what Gianluca said about the human rights issue and all that's contained in there. The implementation of these regulations shall be with full respect for the dignity, human rights, and fundamental freedoms of persons. It's very clear, and it's something that WHO works throughout our mechanisms to support in this and in other FICs. The third principle is the principle of sharing of information, and this you see in Article 6. And I want to focus on the language here because there's been a lot of discussion in the press about how WHO shares information and whether we do so in a way that is objective and impartial. We take in information according to paragraph 6.2, which says, following a notification, a state party shall continue to communicate to WHO timely, accurate, and sufficiently detailed public health information available to it on the notified event where possible, including case definitions, laboratory results, source, and type of risk, and it goes on. So you can see in that there is an affirmative obligation to provide information, but what the actual contours of that information is clearly an issue member states are looking at. And when we get that information, we report that, we process that information, report it back to all states parties through the mechanisms of the IHR, and then report it publicly. But WHO does not have an inspection capacity. It does not have an auditing capacity for information. It does not have an intelligence gathering capacity. We rely on the obligation as set out by countries themselves to provide this information and their good faith implementation of that. And if there are areas where improvement is necessary, and there has been, this has been addressed in a number of places, this may be one of those areas. The fourth principle is the principle of authoritative guidance in issuing our recommendations. And here I'm going to take you to Article 17 and show you the criteria that the DG must use, because it's a shall consider, when issuing his recommendations. And you can see here that, again, remember, countries wrote this. Countries wrote this, not the staff. Countries said when the DG issues that there's a list of considerations. First, the views of the state's parties directly concerned, the advice of the emergency committee, scientific principles, as well as available scientific evidence of information. And then the list continues. This is important in understanding why the recommendations, the advice we give has to be evidence-based and takes into account, in accordance with the IHR, these other criteria. And then finally, there is the principle, and this is again what WHO supports in all its work with countries at the country level, at the regional level, and at the global level, the principle of collaboration and assistance. And that is found in Article 44, and this will be the last of the provisions I mentioned, but these are among my personal favorite provisions. This is Article 44, and again, in the hope that it's interesting and helpful for people to see how this language actually looks, Article 44 talks about states parties undertaking to collaborate with each other. You'll see this phrase, to the extent possible, a caveat introduced in the negotiations, but on all of these areas. The more there is that collaboration, the greater the solidarity, the fewer the gaps that exist and divisions that exist, the more effective the response. So this is what WHO works towards in the implementation of these five key areas. And if we could stop sharing the screen now, that would be helpful. I don't see the button to do that, but I hope that answers the question, Suri. Thank you.
Yeah, thank you very much. So that was very clear, and I think you also very clearly highlighted where there is authority and where states have not granted certain authorities to WHO in terms of conducting audits or gathering intelligence, et cetera. I wanted to turn now back to Gianluca, but before I do, I'd just like to remind everyone, after this last question to him, we will be opening up the floor to your questions and comments. I'll be reading through the Q&A, so do feel free to enter your questions and comments. They've already started to roll in. So Gianluca, let me turn back to you and ask you about if you were to take on this project of making the IHR great again, what is the priority for you? What do you think needs to be changed? And what is the likelihood of any kind of change happening given the geopolitical context within which we find ourselves now? And if I could tack on one additional question on top of that, it is how much does it even have to do with IHR? If we want to try to improve global health security so that the world is better protected from the risk of future pandemics like COVID-19, to what extent does this rely on strengthening IHR? To what extent does it rely on changes and decisions made outside the scope of international law? So Gianluca, back to you.
Thank you, Suri. That's obviously the million-dollar question that would deserve a webinar of its own, because the implications of the pandemic as such that have frankly overwhelmed the whole system of international governance, many areas of international law. And so it's obvious from what is happening that if you want to plan for the next pandemic, it cannot be limited to fixing something in the IHR or giving more resources to WHO. There are many other areas of governance that need to be strengthened, clarified, and to a certain extent coordinated. As you said, it's not the brightest moment for multilateralism. And so on the one hand, you had the chance to dream. On the other hand, I think some realism is necessary. Also because there seems to be almost like an inherent, not inability, but what weakness when it comes to health. We've been grappling for 200 years on how to stop epidemics, even for diseases that at some point we know how to fight, we know how to control. We have science, we have the ability of sequencing and sharing the genome of the virus in a few days or a few weeks, and still here we are. There seems something fundamentally intractable when it comes to health events of this gravity. But obviously, we have a window of opportunity that would be suicidal to miss. So I would like to say the following. First of all, I personally believe, and I believe for a long time, that the IHR needs to be in partly revised. My great frustration, frankly, when I was still legal counsel, it is absolute taboo in WHO about reopening the IHR, as if they are some kind of divine object the human hands shall never touch. This is absurd. If there are design weaknesses, they are to be addressed. And the weaknesses are those that I mentioned before: the system of alert, the weakness in the system of recommendation, the lack of accountability, the lack of a system of compliance assessment integrated in the instrument. Maybe I'm too lawyerly. Maybe it's more expedient to do it otherwise. But as a lawyer, to me, there is no big gain in weakening the integrity of a legal instrument that you yourself say it makes a difference in addressing health crisis. So obviously there is a risk when you open an instrument to negotiation, you don't know what you get out of it. So obviously there is a risk of having something that you don't necessarily want, but to me it is worth the risk. Then there is a need for a reflection on what do we want from WHO. I think WHO has done a great job within the limits of the resources. Should we do more? Should they have more powers? Again, the system, the moment doesn't seem too propitious to this kind of delegation of authority, but at least a clarity also in the system of funding. It's irrational to have an organization like WHO funded 80–82% with voluntary contributions. You cannot have a fire brigade that has to raise money when the house catches fire. It's evidently irrational, and something should change in that respect. Obviously, and that's a big variable, you need sustained political, financial investment by states. Otherwise, you can fix the test, but you don't change much. Starting with health systems, but also more broadly in the system of international cooperation and governance that we have now, and I'll come to that. There are a few, in my view, evident gaps. The first is what I witness now: travel restriction, trade restrictions, beggar thy neighbor policies, totally uncoordinated, unilateral, sometimes driven by very short-term tactical policy. This is clearly proven counterproductive. There are enough economic analysis that it may meet the panic of the moment, but in the medium term, it's just not working. How to address that? Because that's part of the weakness of the IHR, or the system of recommendation. So looking at that will also strengthen the pull, the bite of a legal instrument. And I would see certainly a system of, almost like a compulsory system of international consultation at the very least. This can be framed as a health thing, so led by WHO. It requires the input of many other sectors. But when states start imposing this kind of measure, that there is a requirement to literally sit around the table and compare risk assessment. Why am I doing this? Why are you doing this? This doesn't have to be under the limelight of scrutiny. It can be something more discreet, can be something behind the scenes, can be something mediated by the Director General, but you need that kind of coordination. The other point is something that is close to the heart of Suri and me, because we have a research project on that, but clarifying the rules of the game to share pathogens. This time, in a way, the emergency was less, because we had the genome in 2 weeks and we had the virus, frankly, at our doorsteps also in a few weeks. But in the future, it may not be the case. So I don't want to give details, but as many people know, it is an argument that has been, a topic that has been very politicized because of the effect of biodiversity law. And there is a lot of work in progress, but a lot of political uncertainties. These need to be clarified. I think we need clear rules for the sharing of pathogens that are different substances from, say, cosmetic or seeds, and possibly new instruments of some nature that should address the rules of the game on how to share pathogens. And then frankly, and that's something where, Suri, you are the authority too. I don't want to throw a hard ball back to you, but you may want to say something which or which I cannot compare. And let's say the issue of access to medicines, which is totally open, and you can see the positioning of government, the reactions of big pharmaceutical companies, I think sometimes in the right direction, already saying, look, we'll cooperate, we'll donate, we won't enforce our patents and so on. But the bigger picture is totally up in the air. So when we have vaccines and antivirals, what will happen? What will happen? Who will get it? Who will decide? According to what criteria? How much will patents and other exclusivity rights be enforced, and so on? And this to me is a test of the durability of that regime, because if we implode on this, I think it will have big systemic consequences that will reverberate also at peacetime and so on. And here, I mean, sorry, I don't want to put you on the spot, but if you would add something, definitely would enrich the conversation.
I would just say that we have a webinar that will focus on that on May 12th.
You should speak louder.
Thanks very much, Gianluca. Very hard and very relevant questions that have also been raised by our participants. One of the themes that has come up across a number of different questions that have come in is the theme or the question of accountability and enforcement. And I actually want to ask both of you to respond quickly to this so that we can get through a number of different questions that have been coming up in the Q&A. But Steve, let me first start with you, and then I'll turn directly to Gianluca after. It's clear that WHO relies on the cooperation, the goodwill, the sharing of information from member states. When member states don't necessarily live up to their obligations, what are the instruments that WHO has at its disposal to try to improve accountability or compliance? And then Gianluca, I'll turn to you to comment on what are some other measures for accountability that might be needed. I think this is a theme that has come up over and over again. Certainly it's a preoccupation of a number of our participants here, but thinking beyond just the narrow scope of what WHO is able to do to hold its own members to account. What are the most promising instruments or actors or forces outside that can actually try to help us get more compliance with these rules that everyone has in principle agreed to? So Steve, over to you.
Hi. So I think in fact one of the five possibilities, one of the five ways to make the IHRs great again is to have very serious consideration by countries for the creation of an enforcement compliance mechanism. Right now, that doesn't exist. There's as Gianluca said, there's a very nominal settlement of disputes mechanism, which says essentially that parties can speak among themselves. WHO does not have the mandate or the power to compel the provision of information. What we do have, and you asked what we do, is we have relationships in the context of which we work to persuade. So we have over 150 country offices. We maintain very close working relationships with every country. This is key to understanding what the particular concerns are, because they differ from place to place. Key to ensuring we have the right technical people and engagement. But it is really this. It is the relationship in the context of which we can persuade, but we don't have the power to compel. And if member states, if countries decide, looking at this, that that's something that needs to be changed, that's certainly an area where WHO would support and provide its full support for that. But it has to come from member states. That mandate can only be provided from the countries themselves.
Let me just jump in before Gianluca, I give the floor back to you. One of the questions that came up was whether any of the international courts, such as the ICJ, might serve any purpose, be able to address this at all. But just to, again, kind of broaden our view beyond what WHO is able to do for accountability.
So I would say, and as you said very cogently in the introduction, the question of compliance and accountability is an open question in many areas of international law. When we talk about compliance, for example, in the context of what is going now, just to be concrete, some of this compliance and accountability can be related to the IHR narrowly. But I think there is a role to play, as you just sort of hinted with the reference to international courts, from other areas of international law and governance. Concerning the IHR, following up on what Steve was saying, I would say the three crucial areas of compliance are, as you say, the provision of information. So basically equipping, enabling WHO, enabling the international community to prepare and respond. The second is a question of core capacities, which is an obligation under the IHR. That was a big leap of faith during at that time. And the third is these questions of measures enacted during a fake, whether they differ from WHO recommendations and so on. So here, again, I think the IHR is relatively weak. Also, the system of chasing states or monitoring states, for example, on travel restrictions and so on, which I know is pursued diligently by my colleagues in WHO, then it's not put to public scrutiny. And that's a political choice. It may be, a legitimate concern on the part of states. It's so other states know what everybody is doing to a certain extent, but here too, there's not much of a bite. So to me, as I said before, an open question is, should there be an institutionalized system of compliance assessment integrated into the IHR? At this time, it's not. But think what happens in other international legal regime. Think, for example, of environment. There are very creative systems of compliance, monitoring, and encouragement that are not antagonistic, are not judging, are not condemning, but literally is to get the picture from states and trying to identify through a dialogue what are the weak areas, because often non-compliance is not a lack of goodwill, is lack of resources. And so these need to be addressed, is what we call the managerial approach to compliance. So this kind of system that could be managed by expert bodies, like in many treaties, think of human rights treaties, for example, or through a peer assessment, I think could sort of nudge countries towards compliance and deter non-compliance. So we can think of many creative possibilities in that respect. The second point is what should happen and could happen and will happen outside the IHR. So what will be the reaction from other areas of international law that can be synergistic to the IHR? And think of, for example, of human rights, what is happening now, unprecedented compression of civil liberties and so on. I'm pretty sure that down the line that will generate some litigation, whether it's with the human rights monitoring bodies or in the American, African, and European context in front of the regional courts on human rights. And the jurisprudence that comes from that could help in testing whether those measures were necessary. That could be used, hopefully, at a policy level in trying to guide or to plan the response to the next crisis. Trade is a similar argument. Many countries have already followed the rules of the game and notified WTO on what they are doing in response to the epidemics, largely suspending tariffs on the import of protective equipment and so on to make them cheaper, but more often restricting export of ventilators, pharmaceutical ingredients, protective equipment, and so on. Does that breach the GATT? Hard to say. The GATT leaves quite a lot of leverage to states to pursue health, to pursue their own security, and so on. But down the line, there will be definitely debates in the various committees of WTO, litigation in front of the panel, an appellate body, if it resurrects from the dead. And that also can generate a useful level of jurisprudence. So we can see reaction from other regimes that can hopefully help clarifying the lines that shouldn't be crossed and in a way improving compliance retrospectively what happened now and prospectively with what may happen at the next crisis.
Thanks, Gianluca. I think that you addressed a number of the issues that were raised by our participants in terms of other bodies of law, human rights concerns, access to PPE, ventilators, drugs, vaccines, etc. But one of the comments that you were making that I was struck by is really kind of down the line in the future. It seems that a number of these other legal instruments, both within and beyond health, might not really have an impact until let's say months or years down the line. Is that a characterization that you would agree with? Is there anything that can be done more quickly because we're really in the heat of a crisis now?
Question to me or to Steve?
In the short term.
No, but the question is addressed to me or to Steve?
Yes. Gianluca, back to you, and then I'm going to turn to Steve in just a minute.
Yeah. What can be done now? I wonder, because it seems to be a generalized meltdown. Probably you will have some pushbacks. For example, you can't exclude it at the regional level. I'm not sure it's the best example, but you remember it in February, March, Germany, France, Czech Republic stopped the export of ventilators or masks and so on, even within the European Union, not only to Italy. And then the European Union took a decision that we would erect barriers towards other states to try to unblock this intra-EU trade. That's pretty horrible. It's an example of collective selfishness, but at least it solved the problem at a sub-regional level. So you could see probably more dynamic at this level, in particular in regions where there are more established institutions. Think of the Caribbean, think of Latin America, think of some of the African sub-regional organizations. Those they may help in solving quickly some of the supply problem that are very much part of the response. The IHR, and here I mean to the extent that Steve is free to express his opinion, the IHR has disappeared, frankly. Since early February, nobody mentions them anymore. They disappear from WHO's own narrative. Look at the WHO's website. You have to struggle to find a reference to the IHR. So my question is, do they still play a role when we are in the middle of a raging pandemic? Because they were clearly designed to avoid a pandemic or to contain it, but we failed. So what is the role of the IHR now? Do they still have a role to play in managing what can be managed? Because that to me is a quick possible response, but it requires in a way a policy choice on the part of WHO and correspondingly a positive reaction on the part of states.
Steve, I'd love to have you respond directly to Gianluca's question. In addition to that, we've had a number of questions come up about the UN more broadly. So for example, can the General Assembly or the Security Council or another body of the UN, for example, do anything about this shortage and these export bans that are preventing countries from being able to access masks and in the future drugs and vaccines, et cetera? What is the role of WHO within the broader UN system? You spoke a lot about persuasion, but what is it that WHO has been doing and can do to try to bring in some of the normative weight in other parts of the UN system? Where are the limits of that? What do you think is actually feasible? But please also say a few words about Gianluca's question, if you would. Over to you.
Great. And I realize we're running out of time. There is so much to talk about, and there could be many of these. But so I'll try to reduce it. I'll try to answer both questions about what can be done now and what can be done with the UN system, and respond to Gianluca's with 2 words. What can be done now is leadership. And this is where the DG, when he uses the platforms he has to underscore the principles of non-discrimination, to challenge racist remarks, which he's done, when he uses his platform to talk about how essential it is to ensure equitable access to diagnostics, to medical countermeasures, to vaccines based on public health needs. All of this, and when he talks about the value, as he did just as so many times, the values of each individual life in these extraordinarily tragic statistics that we're seeing, that's a demonstration of leadership. And it is no small thing. It is not mere words, because it works to establish a level of expectations globally. So it matters, and it needs to be done now, and it's what has to be done now. It's not framed, Gianluca, in the concept necessarily each time of the IHR, but it is grounded in the IHR, as we can see from those principles. So leadership would be the first answer. Second answer, I'll also try to condense it to 1 word, which is what we can do with the UN system and with other partners, because it's a very broad set of partners on global health, is coordination. And so when it comes to vaccine development, when it comes to vaccine production, when it comes to vaccine distribution, that requires some central coordinating body. If there wasn't a WHO, the world would have to reinvent a WHO. But there is, it's committed to principles the world agreed to in the IHR, and so its coordinating function is what is the, back to expectations again, what the expectation of the international community is. And it works because it's efficient, because it's understood, and because WHO is absolutely committed to an evidence-based processes in everything it does, including and especially with respect to distribution of necessary supplies. That involves the trade sector, other sectors, and the work with them is where that will matter.
Can I add one word, follow up on Steve? Because I think he said something very important, this question of leadership. Because if you look at it, there's a lot of literature, of course, international relations in particular, on international organization and what is the power and so on. And one aspect historically has been the role of the leadership of the executive head, of the secretary general, the director general. And in the course of time, we had a few figures like in the UN, Hammarskjöld, maybe Kofi Annan, in WHO, definitely Dr. Mahler, and now I would say Dr. Tedros, that exercise the kind of moral leadership. I think they've been successful, for those that want to listen, in depoliticizing what WHO is doing. He keeps saying, we are saving lives. That's what the only thing we are interested. That's a strong moral claim that to me increases also the authority in WHO in what it's doing. So that I think is a very, very important point that should not be underestimated.
Thank you very much. In fact, I did have a question jotted down about leadership, but I think you've both addressed it very very clearly. Let me just pose one last question and ask you to maybe offer any closing thoughts that you have, because we're coming up right to the end of our hour. And before I do that, I'd just like to say we have a number of really excellent questions that have come in. We'll try to continue to respond to a few of those on Twitter, but they also really inform how we think about the series of webinars that will continue in the weeks and the months to come. So if we didn't get to your question, I apologize, but please know that we are reading them. We're reading them very carefully. So I wanted to come back again to give you both a last word. You know, if there was one thing that you wanted to leave our audience with, what is it that needs to be done at the level? What is the international law can be used for now to help us to do better in the response to this outbreak? What is it? What is the one thing that you would like to leave us all with? Steve, let me turn to you, and then Gianluca to close.
Okay, sorry. So you're giving me a real challenge because I had 5 things, but
two things. Two things.
Maybe 2.
The
priorities.
5 well, I don't think I could reduce it to 1, and to just keep it within the context of the IHR. Maybe I'll just try for 3. And the first thing would be to change this very artificial binary of no emergency or emergency, of all or nothing. That's just not the way the world works, and it's certainly not the way information comes in at the very beginning of any emerging public health crisis. There's a great deal of uncertainty, and there is a need for some ability, some flexibility in that. We've seen the emergency committee struggle with this at almost every time it considers a situation. So there needs to be, that needs to be addressed. There is a need, second, for a declaration of the emergency to matter more. So right now, a declaration of emergency effectively means that there can be the issuance of temporary recommendations. These are important, and that there can be some accountability system for those recommendations. But as we've seen, there are, in any global emergency, there are implications on trade, on equitable access, on law, on human rights. And if a system could work so that there were additional authorities with appropriate checks and balances that were created with respect to these other areas, again, coordinating the global system, this would well serve global public health security. And third, and this goes to a constant issue, which for the IHRs is a sustainable financing mechanism for the IHR, because as Gianluca points out, there are many questions about the effectiveness of the IHR once an emergency has been declared. But what is absolutely critical, and what doesn't get a lot of attention because it doesn't draw headlines, is what happens before an emergency is declared. It's the core capacities, countries' health systems, their surveillance systems. These require continuous strengthening. It is not a do it once and it's done. Maintaining core capacities is much more like brushing your teeth, requires every single day working at it in a determined way, and that requires a sustainable financing mechanism for IHR implementation. So that will be the three things. And I would just throw in quickly a compliance enforcement accountability system that works. And that, by the way, is very much what member states already have begun discussing.
Well negotiated, Steve. You got 4 out of 5. Gianluca, over to you.
Yeah. So no, I really agree with what Steve had said. I would underline again a number of things that frankly seem self-intuitive if you step back and look at them cold-mindedly, but evidently they cut to the core of the system of international relations. One is coordination. And I think we are bumping into it because it will be coordination in softening the current control measures. We ran a risk in locking down. We may be running an even bigger risk in unlocking if there is no some element of coordination among countries, these particular countries that share borders and so on. So I don't know, I hope the WHO will play a role in that because it would be a big missed opportunity if it didn't. And the second thing, as Steve said, and that I know is a big challenge to many countries, including very well-intentioned democratic countries, is the long-term perspective. The fact that investments cannot immediately respond to a short-term profit or political gain. But I think it's something that this pandemic has taught is the need to risk long-term investment in public health, in healthcare, in mechanism of response, or surveillance and prevention and so on. And the big missing word that many people want to hear is solidarity. There has been a bit of an absence of solidarity, or there has been kind of selective. So even if you don't want to be so idealist, let's call it enlightened self-interest, but I think it fulfills the same purpose. So the need to look more long-term and to appreciate the rationality, actually, even on the rational choice approach of coordinating and cooperating rather than closing the doors, and doing so at a much earlier stage. If the world has a fighting chance, is acting at a much earlier stage. Now we are sort of putting band-aids where we can and try, hopefully, to coordinate the return to the normality. Thank you.
Thank you so much.
Last point. We had a lot of excellent questions. I was sort of browsing them very quickly. It would be a pity to lose them. That's a question also for Stephen, who is assisting us technically, whether we can retain them, we can save them, because I would like to engage with some of them offline.
They're enormously important. I've been scanning some of them and very, very helpful.
Yes, absolutely. We'll make sure we get those to you. Thank you so much to Steve Solomon of the WHO and to Gianluca Berci of the Graduate Institute for sharing your expertise with us. If there's one last comment I could make before I share with you the news about next week's webinar, it would be that the willingness to engage in international cooperation, the willingness to recognize what in fact is enlightened self-interest begins at the domestic level, begins at home. And for me, the extent to which countries are willing to express solidarity at the international level is really a product of domestic politics. So for all of those who are joining and who can try to make a difference at national level, thank you very much. So next week, we will be back here at the same time, same place. And I'm really delighted to announce that we'll be focusing on economics, economic contagion, COVID-19 at the intersection of health, finance, and trade. This session will be moderated by my colleague Nadia Wells, who's a research advisor with us at the center. We'll have at least 2 colleagues from the private sector who will be talking about the economic implications, as well as measures that can and have been taken to try to respond to a number of the very, very profound and deep impacts on people around the world, not only in high-income countries, but also very much in low and middle-income countries. And so we hope that all of you can join us next week. This webinar and next week's webinar will all be made available online at the address that you see. Please join our mailing list for those of you who would like to be kept up to date on each of the upcoming events. Thank you very much. Good evening, good afternoon, and good morning.